Hello and welcome to the Art of Being Human. Today I've decided to talk about the care of your feet and your hands, your extremities, and particularly your feet, because feet get into trouble, I think, more than hands get into trouble. And I don't want to spend a whole lot of time on this, but your hands and your feet are your extremities, and they have very, very tiny blood vessels. And if you have a blood supply and you have too much glucose in your blood, then the blood is sticky and it's hard to flow through the blood vessels, especially the tiny ones. And sometimes it gets stuck. And then your cells don't get the blood that they need. And what happens is they eventually die. You have to have glucose in your cells for your cells to function. And if you don't have it, then those cells will die. And when they die, they'll turn black. And pretty soon you have a toe that's turned black. Or it's very easy to have an injury. If you have a slight injury, it can be a little bit of a sore, and within 24 hours, it's a massive sore. And then it gets infected, it's pussy, and then you have to go to the emergency room and get antibiotics and hope that it heals, because a lot of diabetics have very, very slow healing. They do not heal well, even if their circulation is good. Now, I'm fortunate because I have good circulation. And I remember going to my foot doctor and him commenting on how good my circulation was. And there are ways that they can tell how good it is. All they have to do is press on the pulse point with their hands, and they can tell the blood that's flowing through. And he said, you have very, very good pulse points. Your circulation is good. And I says, well, that must be why I heal so fast. And he says, not necessarily. There are some diabetics, they have good circulation, but they still don't heal well. It's a part of the illness, and sometimes they can get into real trouble. Well, I remember waking up one morning, and there was a hole in my foot, a little tiny hole. And it went down. It's as if, the only way I can explain it is it would be about the width of a nail, like somebody had put a nail hole in my foot. And it actually was deep enough that I could have taken a medicine bottle and put some water or liquid in it and put drops of liquid in this hole. I could have done that. I didn't, but it was big enough for that. But that didn't mean it was very wide. It was like a nail hole. And for the first 2 or 3 days, I just kind of blew it off. It wasn't infected. I didn't know how it got there. It wasn't painful. I decided it would just heal. And then I woke up one day and said, what is this? You've got a hole in your foot and you're diabetic. This requires care. So I went to the emergency room of the hospital. I felt fine. And they walked in and they said, oh my God, you've got a hole in your foot. And so we went through the razzmatazz of where did you get it? Did you fall? Did you bump into something? I don't know. I woke up and I had a hole in my foot. So strange things do happen. Well, they started with the antibiotics and they wrapped it up, and I had the antibiotic salve, and I had to change the wrappings every day. And we went through that whole procedure, and eventually it just healed. On another occasion, I woke up. I went to bed, I was fine. I woke up and one of my big toes was like about this big. It was horrible. It was badly infected, and I didn't feel anything. I didn't fall. I didn't do anything unusual. I just woke up with a humongous big toe. I was supposed to go to a meeting in a counseling agency. Instead, I headed up for an emergency room. And they were horrified when they saw it. They said, oh, it must hurt terrible. And I said, I don't even feel it. And I didn't. So it was a bacterial infection. How did I get it? I don't know how I got it, but the idea, and this is what I'm trying to impress upon you, if you have feet, and most people do, some people don't, you need to inspect your feet every day to see that you don't get an infection, because an infection can spread very rapidly. You can have a little sore one day, and within 24 hours you have a bad infection. And so you have to be very careful, which leads me up to my next point. What kind of shoes do you wear to protect your feet? Now, that's not an issue with your hands. You can see your hands. You're doing things with your hands. You're exercising with your hands. You're doing the laundry. You're doing the dishes. There are a ton of things you're doing, so your hands are very active, and that helps with the circulation. But your feet are carrying a very great weight. Your weight is on your feet every time that you're standing or every time that you're walking. That means you're compressing your ankle bones every time that you're walking. So it's a different situation. The care of your feet are a little different than the care of your hands. So you have to watch. You have to make sure that you don't have an infection. One of the things that happens with diabetics is that you don't feel well. You don't have a sense of feeling in your hands and your feet. If you do have a sense of feeling, it may be exaggerated, or it may be painful, or you may feel numb, or you don't have any feelings at all. When you go to a doctor to be checked, and if you're diabetic, you usually have doctor's appointments on an every 3-month basis, they will check the feeling in your feet. They'll have this little instrument with fibers on it, and they'll have you look away. You can't look at what they're doing. And they'll brush against your feet. Do you feel this? Do you feel this? And so they'll take various areas of your feet, and you'll say, well, I don't feel anything now. Or yes, I feel that. Or no, I don't feel anything. And they can tell the areas of your feet that have been most affected by the diabetes, because at some point you may lose feeling. That means if you get an injury on your foot, you may not know it. You may not feel it. And to you, everything's fine, especially in the bottom of the feet where you really can't see. You need to take a mirror and look on the bottom of your feet, because you can get an injury, even a little cut or something like that, and it can develop into a massive infection. And you don't even feel it. There's no pain. But if you have neuropathy, there's a great deal of pain, sometimes when there's nothing wrong that you can see at any rate. So it's important that you wear shoes that are supportive of your feet and shoes that will protect your feet, because you can get into trouble. Right now I have a foot infection going on, and I'm on antibiotics, about halfway through the antibiotics, because I got a little bit of an injury of the toe. I banged up against somebody's stool. I was visiting somebody and didn't see the stool on the floor, and I banged my foot against it. Now, I was wearing shoes, which is good. That's another thing. Don't wear slippers around all day if you're home. Make sure they're in shoes. That will help also to protect your feet. Well, I lost the nail and it started bleeding, and so I headed to a clinic. And so I'm on antibiotics and the bandages and all of that stuff. And all I did was bang my foot. So it doesn't take much. So what kind of footwear should you wear to protect yourself? Well, I have here some. I have a whole bunch of these fake shoes. I do services in nursing homes, and I sometimes demonstrate what I'm talking about. You need to have a shoe a little bigger than this. That's a tie shoe, or gives a lot of support to your feet, like a running shoe, kind of a sneaker. I think this is cute, but at any rate, and it ties, and so your foot is supported, and it has a good support inside. This shoe is fake, of course, and the same thing, you can see that it ties up. That's also a dog toy. A boot that is going to be very supportive and very protective in the outside of it as well as in the inside of it. And of course, you can wear other shoes, other styles of shoes as well. I was always told you need to get diabetic shoes. Well, they've come a long way. I said I don't want to wear something that looks like a boat. But if they don't, now they're fairly stylish. So there are various things you can wear. What you don't want to wear, if you're interested in sandals and slides, because this is fake, this is kind of a toy, you don't want to wear a shoe in which you have a strap that comes in between your toes. So pretend my hand is a toe and you are wearing a slide or something and it's comfortable, but you've got that strap in between. You don't want to do that. The reason being is that it is so easy to start a sore because you can't wear socks or anything with this. The strap has to be in your toe, in between your toes for you to keep it on. And then what happens is you get a sore on your between your toes, and it doesn't take much. It's just a little sore, and it can be so easy to get an infection. Let me hold this up. I just sketched this out. On the top, a shoe, I mean, it's not the best because it doesn't have the support it needs, but at least it doesn't have anything between your toes. So it's fairly safe as long as you can walk and don't need the extra support. But then you get a shoe that's very much like it, but you've got here that little strap that goes in between your toes. That little strap can cause you to have a massive, massive infection. And it starts off small, but for some reason the feet infect, and it infects very rapidly. So it is very important that you take care of both your hands and your feet, but especially your feet. Examine them every day with a mirror to catch the bottom part. If you see something going on, go to the doctor right away. Don't wait. If you have a scratch or a wound, or if you know bleeding. I've lost enough feeling in my feet, so sometimes I don't know anything is wrong unless I see bleeding. And then I automatically go to the doctor or a walk-in clinic or something to get it looked at because I know what will happen. If you get an infection, it's very, very difficult to get rid of a foot infection, and it's also very, very dangerous. So I need to bring that up to you. Now I want to go into neuropathy. If you have been a diabetic for about 25 years or more, you probably have neuropathy. And neuropathy is a nerve damage to your nerves because of diabetes. Too much sugar in the blood damages the nerves, and the nerves do not act normally and cannot fire their impulses normally, and it can be a real problem. Once you're diabetic for so many years, you will get symptoms of it. Now, the diabetes won't damage your brain or your spinal column. You're not going to get neuropathy in the central nervous system, but where you're going to get it is every other nerve in the body, which is a lot. So the nerves of the spinal column and brain are safe from it, but the other nerves are not. And you will have a lot of problems because you start to lose your feeling, especially in your legs and your feet and your hands. You'll start to lose your feeling. You will not be able to feel pain, or sometimes you'll feel pain too much. Sometimes you'll feel things that you don't understand where it's coming from. Sometimes you won't feel at all. You can get very, very numb. And the sensations you're going to have with neuropathy, you're going to have sensations of tingling, burning, pain, itch, and it's very bad. I remember when I was driving a lot, and I still drive quite a bit, but after a certain amount of driving, I would get these sensations in my feet, and they drive you crazy. You can get them in your hands, too, but it's like a halfway between a pain and an itch, and you want to do something, kind of grabs you, and you find yourself rubbing your hands or scratching your fingers. I used to even take car keys and rub car keys, something rough, against my fingers, just to see if I could get rid of the sensation. Now, when that happens, usually your blood sugar is out of whack and it's too high. If you keep your blood sugar down to normal, or pretty much normal, as much as you can, then a lot of those symptoms just go away. But you can get neuropathy symptoms in other organs of your body as well. It can affect your bladder, so you can't feel that whether you've emptied your bladder or not, which can lead to urinary tract infections. It can affect your bowels, so you end up either having diarrhea or constipation. It can affect your stomach so that you don't digest right, and you end up by having slow digestion where it takes a long period of time to digest your food, and as a result of that, your whole alimentary canal, your colon, all of these organs are affected. It can cause impotence, and the blood vessels, you see, need to be healthy in order to send out the signals that they're supposed to send out. If they're damaged by excess sugar, then they can't do what they're supposed to do. So there needs to be a constant blood supply for you to be able to have the nervous system work the way that it's supposed to work. Smoking and alcohol are very, very damaging to the nervous system. If you are smoking, it would be a lot better, and I can't tell you what to do, but if you are smoking and drinking, you would be better off if you didn't do it, because it has an effect on the nervous system, especially if you're diabetic. I know I have cardiac problems, and when I go to the doctor, they always check, well, are you smoking? Well, I've never smoked a cigarette in my life, and that's probably why I've done so well with it. I've been diabetic for 25, 27 years, and I've led a very normal life. Now, I have to be meticulously careful about what I do. Sometimes I'm not careful enough, but as a general rule, I'm pretty careful, and as a result of that, I've lived a good long life with diabetes, and I've had a very normal life, and I've been very creative. I've been very active. My doctor tells me I'm more active than most people my age, and it's due to the fact that I've taken care of myself. You have to take the illness seriously. When you're first diagnosed, you have trouble wrapping your head around it. And most people who are first diagnosed, they're afraid. You know, me, diabetic, and what they're thinking of, I'm going to go blind, I'm going to lose my hearing, I'm going to lose my legs, and all of that stuff. But a lot of those complications can be stopped. And if you just are careful about what you do and take it seriously from the very beginning. So the symptoms of neuropathy will be basically what you can feel is going to be in your arms, hands, legs, and feet. They'll feel numb. You'll lose sensitivity to temperature, so you don't know how hot or cold it is. You can't judge sometimes the position of your limbs. I don't have that problem, but if I did, I might not know where I had my hands. If I'm talking to you and I stick my hand out here, I might not realize where it is. You can also have shooting pains, stabbing pains, burning, tingling, prickling, and muscle weakness, all from neuropathy due to the nerve damage because you have too much sugar in the blood. It's, as I said before, sometimes a kind of between a burning sensation and an itch, especially in the extremities, but it affects other organs of the body as well. You don't necessarily feel it until you run into a problem. You're more aware of what's happening in your hands and feet than other parts of your body. But other parts of your body are also being affected. The symptoms go away as you get your blood sugar more under control. There are two types of neuropathy. There's an autonomic neuropathy, and I'll get into that first, and there's a focal neuropathy. I don't know if I'm going to quite finish this. I don't know if I have the time to do it, but we'll try. Now, in autonomic neuropathy, it affects the nerves that you don't move voluntarily. You know, you have your autonomic nervous system, and you have your central nervous system. You move your hands automatically. You move your body automatically. You don't have to think about it. But in autonomic neuropathy, it affects the nerves that you don't move voluntarily. It affects the parts of the body. In the stomach, it'll slow down your digestion. It may give you nausea and vomiting, and it will give you constipation and diarrhea. That's due to nerve damage in those areas. And it'll affect your bladder. Your bladder nerves can be damaged, so you don't empty your bladder completely, and you don't know that because you can't feel that, and as a result of that, it leads to urinary tract infections. It can affect your blood pressure. You can be lightheaded, you can be dizzy when you're standing up if your blood pressure becomes too high. high. That's due to the neuropathy. That's part of the problem with neuropathy. The nerves to the heart can be affected, so the heart rate does not change. And you're exercising. When you exercise, the heart rate should get up. Sometimes it doesn't. It can't tell, and that's due to the neuropathy. You can have something called Charcot's foot. In Charcot's foot, it affects the weight-bearing joints, so you have loss of feeling around by the ankles, and the bones get out of alignment. Then you can damage your ankle bones, and you can have fractures. Now, sometimes you don't even feel those fractures. They can be painless, but nonetheless, the fractures are there. And that's one of the reasons you have to be so careful of what you wear for for shoes and so forth, because you need to keep your bones in alignment. The other type, I guess we can finish this, the other type is called focal neuropathy. That's more rare, and it's when you have one single nerve or a group of nerves kind of connected together that are shut down and shut off, and it's usually not permanent. Carpal tunnel is a type of that, and sometimes you have to have surgery just to get the nerves open again. So that's focal neuropathy, not as common as the autonomic neuropathy. Those are the two types of neuropathy. And I've already talked to you about infections. Excess sugar in the blood makes it easy for you to get infections. The white blood cells attack the other blood cells, and then you have an infection, and the blood sugar is too high, so it makes the white blood cells less effective, so it's hard for you to fight off infection. And so diabetics are more prone to infection of their mouth, their gums, their lungs, their skin, their feet. Incisions from surgery, the genital area, a diabetic is going to be more prone to infection, and I know we have talked about sanitation, so keep that in mind. So you don't always feel the need to check yourself constantly, but you have to do that, because with diabetes, you just don't know what's going on because of lack of feeling, so you do need to check yourself. Now, I'm going to close it here because we're just about out of time. We will continue with more information next week about the feet. I want to go into foot ulcers and things like that, and then we'll continue from there. We do have a few more segments to go. I want to go into the complications. I want to go into the tests that you take as a diabetic, and then the psychological aspects as well. So we'll just keep on going with this. I think it's important, and I think a lot of people can be helped by this. So we'll close it here. Please join me next time.